Welcome back to the deep dive.
Great to be here.
Today we're jumping into something really important, maybe a bit sensitive, but crucial for health. Genitourinary health.
Absolutely. It covers a lot. STIs, kidneys, UTIs, things that affect so many people.
Exactly. And we've gathered, a ton of material medical reviews, research notes, the whole 9 yards.
Our mission really is to cut through the dense medical speak.
Yeah, pull out the stuff that actually matters, the facts, maybe even some surprising bits about these conditions.
Because understanding them is key for your own well-being, right?
Nice.
These things are super common, but often kind of hidden.
Totally hidden.
And the genitourinary system itself, it's working away silently most of the time, filtering, balancing,
Like a background process you don't notice.
until something goes wrong. And while it might sound complex, we're hoping to find those aha moments today.
Find the connections, focus on what you really need to know.
Exactly, making you a more informed advocate for yourself.
Okay, let's dive in. Starting with STIs, sexually transmitted infections.
Right. Now, in medicine, these are often called high-yield topics.
High yield, meaning what exactly?
Meaning they often present with really classic, sort of stereotypical signs, things doctors are trained to spot.
Okay. Recognizable patterns.
And this is huge, but many of them, like chlamydia and gonorrhea, can be totally asymptomatic.
Meaning no symptoms at all, you wouldn't even know.
Precisely. You could feel perfectly fine, and that's why routine screening is just so important.
If you don't know, you can't treat it, and you can pass it on without realizing.
Exactly. Which leads to another key point. Some STIs are actually reportable.
Reportable. To who?
To the local health department. Think chlamydia, gonorrhea, syphilis, HIV.
Why is that? Public health tracking.
Yep. It allows for contact tracing, trying to find others who might have been exposed, and controlling the spread in the community. It's a big public health tool.
Got it. Okay, so let's talk specifics. Trichomoniasis.
Trich. This one's known for something quite distinctive visually.
Which is?
What doctors call a strawberry cervix.
Strawberry cervix. Okay, paint me a picture.
It's these tiny little red dots, pinpoint hemorrhages on the cervix. Makes it look speckled, kind of like a strawberry surface.
Wow, okay. That's memorable. Any other signs?
Often a greenish, frothy discharge, too. Diagnosis is usually with a very sensitive test, a PCR test polymerase chain reaction.
Looking for the bug's DNA?
Essentially, yes. And here's the absolutely critical treatment point for trich.
What's that?
The partner or partners must get treated, too, at the same time.
Oh, right. Otherwise, it just bounces back and forth.
Exactly. Reinfection is almost guaranteed. You break the cycle by treating everyone involved.
Makes sense. Now, the sources also mention bacterial vaginosis, BV, often in the same breath as STI.
Yes, they do. And it's important to clarify this up front. BV is not technically an STI.
Okay, so what is it then?
It's more of an imbalance, a shift in the normal, healthy bacteria that live in the vagina.
What causes that imbalance?
It's often linked to things like douching, which can disrupt the natural environment down there.
Interesting. So how is it diagnosed?
Doctors look for a few key things. On a microscope slide, they might see clue cells.
Clue cells?
Yeah, vaginal cells that look like they're coated or studded with bacteria. And there's often a positive whiff test.
A whiff test. Sounds descriptive.
It is. A strong, often fishy odor is noticeable, especially when a chemical is added. These signs, plus others, are part of diagnostic criteria like the Amsel criteria or Nugent score.
And treatment for BV. Does the partner need it, like with Trich?
Generally, no. Partner treatment for BV isn't usually necessary unless the male partner happens to have symptoms, which is pretty rare.
Okay, so key difference there. Let's move to chlamydia and gonorrhea now. We said they could be asymptomatic.
Very often asymptomatic, yes. But if symptoms do show up,
What might someone experience?
could be painful urination, maybe discharge. In women, possibly bleeding between periods or pelvic pain. In men, maybe testicular pain or swelling.
How are they usually diagnosed?
With a test called a net nucleic acid amplification test. It's very accurate and can often be done on a urine sample or sometimes swabs.
Okay. And you mentioned something interesting about the treatment.
Yes. This is really critical, actually. It's the co-treatment rule.
Co-treatment.
Standard medical practice is to treat for both chlamydia and gonorrhea together, even if only one test comes back positive.
Wait, why treat for both if only one is confirmed?
Because they so often occur together, and the risk of missing one is too high. Untreated chlamydia or gonorrhea can lead to pelvic inflammatory disease, PID.
PID. I've heard of that. What does it involve?
It's a serious infection of the reproductive organs in women. usually severe abdominal pain, fever.
Yeah, the consequences.
They can be really significant. Long-term reproductive harm, like chronic pelvic pain, ectopic pregnancy, even infertility. So co-treating is a preventative strategy.
Wow. Okay, that makes a lot of sense. Being cautious to avoid much worse outcomes.
Exactly.
That leads us nicely into another complex one, syphilis. Our sources describe it as a multi-stage disease.
That's right. It progresses through typically 4 stages if untreated.
Okay, stage 1.
Primary syphilis. The hallmark is a single painless sore called a chancre. Usually appears where the bacteria entered the body.
Painless. So you might not even notice it.
Correct. Or dismiss it. Then comes the secondary stage.
What happens then?
This often involves a rash, and it's quite distinctive because it frequently appears on the palms of the hands and the soles of the feet.
Palms and soles. That rings a bell. Didn't the notes mention something else that causes that?
Ah, yes, the teacher's tip. Rocky Mountain spotted fever also classically causes a rash on palms and soles.
So it's a key differential diagnosis for doctors. Something else to consider.
Exactly. It's a good memory hook. After the secondary stage, if it's still untreated, it can enter the latent stage.
Latent meaning dormant.
Pretty much. The bacteria are still there, but there are no signs or symptoms. This can last for years.
And then?
Then, potentially, the most serious stage, tertiary syphilis.
What kind of damage can that cause?
It can affect multiple organ systems, including the heart, blood vessels, and devastatingly, the brain and spinal cord. That's called neurosyphilis.
Neurosyphilis. Sounds serious. How is syphilis diagnosed?
It's usually a 2-step testing process. First, a screening test, like an RPR or VDRL. These look for nonspecific antibodies.
Okay, a general indicator.
Right. If the screen is positive, then you do a confirmatory test, like FTA-ABS, which looks for antibodies specific to the syphilis bacteria itself.
Got it. Screen first, then confirm. And treatment.
The main treatment is penicillin G, usually given as an intramuscular injection. Bacillin is a common brand name. The dose and duration depend on the stage of the infection.
Penicillin's still the go-to. Okay, next up, herpes simplex virus, HSV.
Right. We often think HSV-1 for oral herpes, cold sores, and HSV-2 for genital herpes.
But it's not always that clear-cut.
Not at all. Both types, HSV-1 and HSV-2, can actually cause infection in either the oral or genital area. There's overlap.
Okay, good to know. And the main symptom is?
Those characteristic, often painful sores or lesions. But here's the really tricky part about HSV transmission.
What's that?
You can transmit the virus even when you don't have any visible sores. It's called asymptomatic shedding.
Ah, that makes it much harder to prevent spread. Is there a cure?
Unfortunately, no. There's no cure for HSV currently. The virus stays in your body.
But there are treatments.
Yes, absolutely. Antiviral medications like acyclovir or valacyclovir are very effective.
How do they help?
They can manage outbreaks, shorten them, make them less severe. They can also reduce the frequency of outbreaks and, importantly, lower the risk of transmitting the virus to a partner.
How are they taken?
2 main ways. Episodic therapy means taking the medication just when an outbreak occurs. Suppressive therapy involves taking a lower dose daily to help prevent outbreaks altogether.
Right, suppressive to keep it dormant. Good options to have.
Definitely. And just to wrap up the STIs, our sources had a useful mnemonic for the reportable ones.
Oh, yeah. Let's hear it.
C. Getting checked seems highly important.
Okay. CG.
Chlamydia, gonorrhea, chancroid, syphilis, HIV, and AIDS.
C. Getting checked seems highly important. Catchy. And that just reminds us why public health tracking matters for these specific ones.
Exactly. It underscores their significance from a community health perspective.
All right. Deep breath. Let's shift gears now. Moving from infections to our kidneys.
Ah, the unsung heroes.
That's how the sources describe them. Natural detox machines, which is pretty accurate. Right?
Totally accurate. Their functions are absolutely vital. They're filtering your blood constantly.
Pulling out waste products.
Removing waste, balancing fluids, managing electrolytes like sodium and potassium. I mean, they keep everything in equilibrium.
And doing all that work behind the scenes.
Until they start to struggle. And that's when we talk about chronic kidney disease, or CKD.
CKD. What exactly is that?
It's basically a gradual loss of kidney function over time. It doesn't happen overnight.
And what puts someone at risk? The sources mentioned 3 big ones.
Yes, the major risk factors are getting older, having diabetes, and having hypertension or high blood pressure.
Age, diabetes, hypertension.
Got it. And you mentioned kidneys work silently. Does that apply to CKD too?
Very much so, especially in the early stages.
Yeah.
Early CKD is often asymptomatic.
No symptoms again.
Yeah.
So like with STIs, you wouldn't necessarily know you have it.
Correct, which makes regular monitoring, especially if you have those risk factors, absolutely essential.
So how do doctors monitor kidney health? What are the key tests they use?
The single most important measure, especially for staging CKD, is the GFR,
GFR.
glomerular filtration rate. It's basically a calculation that estimates how well your kidneys are filtering waste from your blood.
And what's a critical number there?
Well, what's really significant is when the GFR drops below 15 milliman.
15. What does that signify?
That indicates stage 5 CKD, which is also called end-stage kidney disease, or ESKD. Kidney failure, essentially.
Okay, so GFR is king for staging.
Yeah.
What about other common tests like creatinine or BUN? They definitely give clues about kidney health, yeah. Creatinine is a waste product from muscle activity. BUN relates to protein breakdown, but they're less specific than GFR for tracking the actual stage of kidney function loss.
Gotcha. And just a regular urine test, a urinalysis, can that tell you anything?
Oh, absolutely. A urinalysis is crucial. It can pick up things like proteinuria.
Protein in the urine.
Exactly. Or hematuria blood in the urine. These can be early signs that the kidney's filters are damaged.
And there was a specific tip about protein for diabetic patients, wasn't there?
Yes, the teacher's tip about microalbumin testing.
Oh, microalbumin.
It's a test that detects very small amounts of albumin, a type of protein, in the urine. It's super important for people with diabetes because it can signal the very earliest stages of kidney damage, often long before the GFR starts to drop significantly.
So finding that early allows for intervention.
Precisely.
Yeah.
Early detection means you can implement strategies like tighter blood sugar and blood pressure control or specific medications to protect the kidneys and slow down the progression of disease.
Makes sense. Catch it early. Now, the sources also mentioned something called urine casts. Said they were a red flag.
A big red flag, yes. Casts are basically tiny molds of the kidney tubules formed from cells or proteins that get packed together.
And different types mean different things.
Exactly. Seeing red blood cell casts, or RBC casts, strongly points towards glomerulonephritis.
Which is inflammation of the filters.
Right. Inflammation of the glomeruli, the tiny filtering units, whereas seeing white blood cell casts, WBC casts, usually indicates pyelonephritis.
Pyelonephritis. A kidney infection.
Yes, or sometimes another inflammatory condition called interstitial nephritis. But seeing any cellular casts like RBC or WBC casts means there's something significant happening within the kidney itself.
So if casts show up on a urinalysis,
it definitely prompts a closer look, maybe more tests, or even a referral straight to a nephrologist, a kidney specialist.
okay. So if someone does have CKD, what's the approach to management?
The main goals are really to slow down the progression of the disease, prevent it from getting worse, or at least slow the decline.
How do you do that?
Strict control of the underlying causes, so managing blood pressure very tightly, controlling blood sugar if the person has diabetes. Also, certain medications, like ACE inhibitors or ARBs, are often used specifically because they have kidney protective effects.
And managing complications too, I assume.
Absolutely. CKD can affect bone health, cause anemia, electrolyte problems. So managing those is key. And unfortunately, if it progresses to end-stage kidney disease, ESKD,
GFR below 15.
yes, then renal replacement therapy becomes necessary.
Which means
Either dialysis, hemodialysis, or peritoneal dialysis, or a kidney transplant.
huge quality of life difference there, obviously.
Massive.
Okay, let's pivot one last time to something incredible common. Urinary tract infections, UTIs.
Ah, yes, very common indeed, especially in women, but men get them too.
What's the usual cause?
Overwhelmingly, it's bacteria. And the most common culprit by far is E. coli.
E. coli, isn't that normally in the gut?
Exactly. It usually lives harmlessly in the gut, but if it gets into the urinary tract, it can multiply and cause infection.
And the symptoms are usually pretty recognizable, right? The classic presentation.
Very classic, usually. That burning sensation when you urinate.
Yep.
Increased frequency, feeling like you have to go all the time. Urgency, feeling like you have to go right now.
Sometimes pain too.
Yeah, sometimes lower abdominal discomfort or pain right above the pubic bone. We call that suprapubic pain.
Okay, those are the classics. But the sources highlighted something important about atypical presentations.
Yes, this is clinically very important. It raises the question, how else can UTIs show up, especially in certain groups?
And the key group mentioned was
Older adults, Elderly individuals often don't get those typical urinary symptoms.
Really? So no burning, no frequency?
Sometimes none at all. Instead, they might present with sudden confusion or new onset delirium, or maybe just generalized weakness, feeling unwell, what doctors call malaise.
Wow, confusion from a UTI.
Absolutely. It's a very common cause of acute confusion in the elderly. So the practical point is, if an older person suddenly becomes confused or weak,
You have to think about a UTI.
you have to keep UTI high on your list of possible causes, even if they're not complaining of any burning or urgency.
That is a really crucial piece of information. Okay, how are UTIs typically diagnosed and treated?
While often the symptoms are so classic, treatment might be started based on those alone, especially for a simple, uncomplicated UTI. But a urine culture is often done, particularly if the infection is recurrent or if it seems more serious, to confirm the bacteria and check which antibiotics will work best.
And for treatment of a standard, uncomplicated UTI in a generally healthy adult?
The first-line antibiotics are usually nitrofurantoin, brand name Macrobid is common,
Okay.
trimethoprim sulfamethoxazole, often called Bactrim,
Bactrim, right.
or sometimes a single-dose antibiotic called fosfomycin.
So relatively straightforward for uncomplicated cases.
Yeah.
But what if it's not uncomplicated? What if the infection spreads?
Right. If the UTI travels up from the bladder to the kidneys, that's a much more serious condition called pyelonephritis.
Pyelonephritis, the kidney infection we mentioned earlier with the WBC casts.
Exactly. This is a serious UTI involving the kidney tissue itself.
How would someone know if they have pyelonephritis? What are the symptoms?
They're usually much sicker than with a simple bladder infection, typically fever, chills, feeling quite unwell.
And pain.
Yes, usually flank pain, that's pain in the side of the back over the kidney area. Doctors might check for CVA tenderness, costovertebral angle tenderness, which is pain when they tap gently on that area.
And treatment for pyelonephritis.
It's much more aggressive, often requires hospitalization for IV antibiotics initially. If it's treated outpatient, which is less common, it requires stronger, broader spectrum antibiotics.
Like which ones?
Often fluoroquinolones, such as ciprofloxacin, Cipro, or levofloxacin. These are more powerful drugs reserved for more serious infections.
Because pyelonephritis is serious.
It absolutely is. A kidney infection needs prompt and appropriate treatment to prevent complications like kidney damage or the infection spreading to the bloodstream.
Underscores why treating even a seemingly simple UTI properly is so important. Don't want it escalating.
Precisely. Timely treatment matters.
Wow. Okay, we have covered a lot of ground today, from STIs and their often silent nature to the incredible work of our kidneys and CKD, and finally, the common UTI and its variations.
It's a complex but interconnected area of health.
Absolutely. And our hope, really, is that unpacking all this, pulling out those key facts and, those atypical presentations, helps you feel more empowered.
Empowered to advocate for your own health, maybe recognize signs in yourself or someone else.
Yeah. We threw a lot at you, but the aim was to give you those really impactful, memorable takeaways, the things that stick.
And maybe just to leave you with a final thought, if we connect this all back.
Go on.
Given that so many of these genitourinary conditions, the STIs, the early kidney disease, even UTIs in older adults, can be asymptomatic or show up in really unexpected ways.
Right. The silent or confusing presentations.
What does that really tell us about how important proactive health monitoring is? And maybe even more crucial, having open conversations with your doctor, even when you feel perfectly fine.
That's a great point. It suggests maybe we shouldn't wait for obvious symptoms to pay attention or talk to our providers.
Exactly. How might knowing all this actually change how you approach your own health strategy or the conversations you have about it? Something to think about.